One thing that I think is actually really interesting is that there's been the launch of the NHS 10-year plan. It seems that things are going to be going more digital, prevention focused, and more community based services, which sounds really interesting. And tackling health inequalities, both in access and outcomes, is mentioned within this strategy. So that's actually really good. And I'm really pleased that HIV is specifically mentioned within the plan, which is fantastic. However, we know that health inequalities affecting Black communities has been around for generations, particularly for Black women who face intersecting forms of disadvantage. So it's not going to be an easy fix to address these health inequalities. I think it's really important that when they look at this plan, they take into consideration all of the different drivers of the health inequalities that we're seeing. And also, it's really understandable why some people in our communities are untrusting in terms of what's been happening in the healthcare system. So it's really important that the NHS works in partnership with Black communities in terms of addressing all of these inequalities.
Yeah, definitely. I think that the NHS 10-year plan actually is a good thing. I think it's going to be focusing on localized health, so around 300 community health hubs, which we hope will be able to address a lot of other issues, such as mental health, supporting people with rehab, and looking at generally at the social determinants of health. So I really do think it's a great thing, and I think also the focus on prevention and digital health, because going right now, and we just have to make sure that we don't leave anyone behind, especially in terms of new technologies. So I really feel good about it.